Hi, I'm Dr. Thomas Schuler. I'm a spinal surgeon, CEO of the Virginia Spine Institute, and chairman of the Medical and Scientific Board for the National Spine Health Foundation.
Thank you, Tom, for being here today. I'm Dr. Rita Roy. I'm the CEO of the National Spine Health Foundation, and we are here today to talk about the crisis that is affecting our nation right now. We are in the midst of the COVID-19 pandemic, and today we're going to talk a little bit about what the impact this has on our nation and in particular on spinal health. Dr. Schuler, you are seeing a reduction in the ability to treat people for their spinal conditions. What does that picture look like for you right now?
So our practice has lost half the patients that normally come in because everybody's afraid and they're quarantining and staying at home. But actually, the people we're seeing desperately need our services. The people that are coming in are in crisis, they're in severe pain, they need help. And that's the important thing, is that it is essential that providers are out there to help the people that are in crisis. Because you don't want to go to the emergency room nowadays. And so it's by being available, using proper cleaning techniques and the proper use of masks and appropriate treatment of both the medical staff and of the patients with masks and sterilizing everything we can to make sure that we protect everybody, but we're there to provide that essential care.
Yeah, I think that's really important for patients to know that they can see their doctors during this time if they have, an exacerbation of their pain, and that they really should reach out to their doctor's offices to figure out how to do that. I think, one of the things we look for silver linings during times like this, and one of the things that I've seen come to the forefront is the implementation of telemedicine. For many, many years, the promise of telemedicine has been out there, but it takes a crisis, almost to make something like that become part of our daily routine.
If we take a look at healthcare, healthcare sometimes moves very slowly to evolve. And telemedicine is not perfect. It's great for certain things, but the problem with telemedicine is you can't reach out and touch a patient. And so you have to rely on asking the patient questions to get information. But because of this pandemic, telemedicine is now going to be ubiquitous. It's throughout the healthcare system. Yeah. And any practice that is trying to stay afloat is doing telemedicine for the safety of their patients, the safety of their providers, and using it. Having said that, in our practice, we had not done telemedicine prior to this epidemic, like so many other practices across the country, yeah. And we're doing it now. And it's actually working out quite well for the patients that need to have that contact.
Yeah, and I think that you point out that with telemedicine, you can't reach out and touch a patient, but so much of the time having the conversation with the patient almost as a triage, because a lot of times people don't understand, am I having an emergency situation with my pain, or is this just an exacerbation where I need to modify my movement or do some different exercises? Let me just talk to my doctor.
So that is the power of the telemedicine, is that people aren't prevented from having meaningful audio-visual communication with their healthcare provider. Mm-hmm. And there are things we can look at patients, see how they move, and have discussions about where they hurt and understand. And then that can lead to us recommending treatments. And for some of these people that we've done telemedicine visits on, we've realized that they need a certain medication, or they need an injection, or they need a better evaluation, mm-hmm. And then we can act appropriately.
If we look at situations like this to drive innovation, that can be a very exciting outcome of a moment like this. And thinking about the use of telemedicine and all the ways that it can be used for patient care really is going to be a positive outcome of the pandemic. But I think there are other scenarios that are not going to be as positive an outcome. We know in the Spine Health Foundation that, the ergonomics of working at your desk or teleworking are going to be challenging for people. We say, don't work in bed, mind your posture when you're teleworking, make sure your laptop's at the right level. Do you anticipate that you're going to see people on the other side of this situation having exacerbation of their conditions?
Well, not only on the other side, it's happening now because we're getting the calls from those people and they're coming in to see us, or they're calling us and doing a telemedicine visit. But at the end of the day, when you have a beautiful ergonomic workstation to do your work at, that helps you optimize your ability to function. But you hear stories of people, they have to go in a closet at home to find peace and quiet, and they're working on their laptop in a closet. Not quite the best ergonomics. And so we have to deal with the reality of the situation. And to that point, I'd like to just say that what we all need to be doing, and anybody who's got a neck or back problem, which is really just about the entire country has it at one point or another, but if you're in that phase, you have to be working on your flexibility, your strengthening, moving, and you can't say that I can't go to the gym so I can't do anything. And that's what's important, is to have a home exercise program. And do you want to comment on the resource the foundation has?
Yes, at the Spine Health Foundation, we put out special information during the COVID time, but also regular information that's always there about simple tips and tricks that you can do at home that don't require gym equipment, don't require you to be in a group fitness class. These involve simple stretches that you can do, looking at your workspace, and at the end of the day, moving, just getting your body moving. We've heard from patients who live in apartment buildings and they go into the staircases and they walk the stairs just to get their selves moving because they're not able to go outside or the weather is bad or what have you. So wherever you are, whatever your situation is, figure out a way that you can get at least at a minimum movement into your life. That's true during the pandemic, but that's true all the time. One of the simple things that we say over and over again in lots of our material is make sure you get up and stand at least once every hour. Set a timer, put the timer on your iPhone or your watch, build it into the schedule of your day so that, I myself find that hours go by and I haven't moved out of my chair, and I've got to set a timer to make sure that I get up, stand, stretch, move.
Yeah,
those are the kinds of basic information that experts tell us and
right.
that are really true.
Yeah, that's a great point. I mean, the main way to avoid so many problems in your neck and back is to have the appropriate mobility, the strength, the conditioning, and by maintaining that, you help. So many times, little joints in the back, facet joints or your sacroiliac joint lock up, and it can cause excruciating pain. It's like somebody stabbing you with an ice pick. And how do you stop that? Proper mobility, strengthening, conditioning. And so if you're stuck at home, sitting on the couch, watching the news, getting depressed, then you're not doing what you need to do.
I'd like to talk now also about wellness and nutrition during the pandemic time, but again, also during the regular times of our lives. We all know that staying hydrated helps your discs function. We know that in the Spine Health Foundation, and our experts know that, but we want to make sure that all Americans know that staying hydrated is really important. Going to the grocery store right now is a challenge during the pandemic. Grocery stores are limiting the number of people that can go in or the hours that you can shop. So we have to think harder and smarter about how we're feeding ourselves during the pandemic. Tom, could you talk a little bit about nutrition and the spine?
Sure. Some simple things we can do to help us through this pandemic. And the big three are keep your hands clean. Don't touch your face, your eyes, nose, mouth, because that's how the virus gets into your body. And maintain appropriate social distance so that you're not getting the virus on you. But aside from that, what we really know is that there's 7 things you can be doing to help your immune system and your overall health and wellness. And that's a little bit what we were just talking about. So I put number 1 is absolute nicotine abstinence. Nicotine impairs the healing of the body. So vaping and smoking are very detrimental to your body to heal, but it also severely impairs your airways. The airways are lined with little fine hairs called cilia, and these cilia move all the garbage out of our lungs and clear it. But if you smoke or vape, then you're killing those cilia and you can't clear your lungs. The second thing is to get exercise, and that's what we've been talking about, is exercising so that you maintain your aerobic conditioning, your flexibility, your fitness, your conditioning, and doing that for 30 to 60 minutes a day is critical every day, but especially while we have much more restrictive activities. And then we talk about nutrition, and I think proper nutrition is critical. And if you eat a perfect balanced diet, you may be the one person that may be able to get away without vitamins, but taking appropriate supplements helps for those imperfect diets, and especially when you can't go eat everything you want to eat. And so you get the nutrition, and I recommend taking appropriate multivitamin, vitamin C, zinc, whatever you decide is best for you, but but supplementing it. Now, I look at it as an insurance policy that just in case you're not getting the things in your diet, you're covering it. The next area is to make sure that you're getting enough sleep. Sleep is critical for your overall immune system. And if you're not getting enough sleep, your immune system gets depressed and you have problems with that. Keeping your hands clean, but when you're washing them and using soap and detergents, your skin dries out. So I'd say moisturize your hands so that you don't end up with little cracks in places where the virus potentially could go through the hand or just have other issues. So keeping your skin moisturized to protect it so that the only true source is through the eyes, nose, and mouth. And then at the end, I think that avoiding stress is so critical. And I think that people get too stressed about things. And watching the news nowadays, it's easy to get stressed.
Right.
And so by minimizing how much you watch the news to just getting a few minutes in the morning and the evening to understand what's going on, but then spend the rest of the time doing creative things, constructive things, exercise, playing games, being with your family, and being healthy. At the end, I kind of summarize this whole part of protecting yourself as doing what's right, but keeping your hands clean, don't worry, and be happy.
That is great advice, great recommendations. At the Spine Health Foundation, we have a list of resources to help you to reinforce this information that Dr. Schuler is sharing with us today. Along the lines of stress, one of the things that we do is we link to some resources on meditation and just taking a time out during the day. I know some of the watches and the Apple products have a meditation or a breathing app. Just simple things like remember to breathe, and take the time out to be good to yourself and to be compassionate to yourself. And this is a difficult time for many, many people, for all of us, and we need to implement these tips to help us get through this.
It's creating enormous economic damage. It's creating enormous medical damage, but the human toll of being isolated, of losing money in the stock market, losing money from wages lost, businesses closing down, that toll is going to be enormous on our society. And I think it's going to dwarf what's happened with the actual morbidity of the virus, the illness that comes from the virus and the deaths that came from the virus. I think worried about opioid crisis in the future, despair, suicide, that's a real crisis. And so the important thing is from a spine problem, you can overcome your spine problems. You need to see the right specialist, get the right care. Modern spinal health care can make you so much better. And it can do it without surgery. It can be the right rehab, the right anti-inflammatories, maybe some injections, maybe regenerative medicine.
Yeah.
But there's so many choices out there. And when you do need surgery, the modern spinal surgery is so vastly better than surgery of old, and it's so successful. So understand there is hope. You can overcome.
Yeah, and Tom, it's so important that we think about maybe using this difficult time to think about building healthy habits. Your spine, it's your backbone. It's going to take you through life, and to get through this crisis. If you've lost your job, times are stressful. The kids are not in school. We need to have a strong body. We need to have the backbone to get us through it, because this crisis will end, but we will be faced with another crisis, which is re-entering our lives. And we've got to be strong in mind and body to overcome the challenges that we need to get there. And, I'm curious, as a spine surgeon and a spine practitioner, how do you anticipate, counseling patients as they come to you? Do you anticipate that there will be more need for physical therapy? How do you see this impacting your practice as we come out on the other side and people are feeling like they need to see their doctor again?
What's interesting is we're seeing far less patients in the office than normal, half, 50%, but we're seeing far more people that need urgent or emergent procedures. And we've had to continue doing surgery on some people during this time period because they were losing neurologic function. They were losing a function in their arm or their leg, spinal cord was getting compressed. And so there is a need out there that has persisted through this period, and we have been providing it. And I think if you reach out to the specialists around the country, that you can get the appropriate skill and service that you need to help you through this tough time. But on the outside, it's again developing this habit of what am I going to do to take care of my health? How am I going to be the owner of my body so that I can live the best quality life that I have? And the benefit of that is not just your spine. Well, that's what I'm most passionate about. But it's the whole body, and it's avoiding hypertension and sleep apnea and diabetes and all the other things that come with a lack of inactivity, obesity, and other things. So this helps your entire body.
We've talked about a lot of the challenges people are faced with during the COVID pandemic. Let's summarize some of the top tips we've talked about today.
Well, everybody knows the basics, which is keep your hands clean, don't touch your face so you don't get the virus into your eyes, nose, and mouth, and appropriate social distancing so you're not being contaminated by people around you. Those are the easy ones, and that's pretty commonly well known all over the media. But for you as a individual, the thing that will help your spine at this time, but throughout life, is to maintain a commitment to your health. And that's having a proper exercise program, getting proper sleep, maintaining appropriate posture and ergonomics. And nutrition is so critical. Avoiding nicotine at all costs is critical. Minimizing your consumption of alcohol so that it doesn't become a detriment. All these things are the important things to help you. So take your vitamins, get your nutrition, stay hydrated, exercise, use your mind, always stay intellectually challenged. And if you do these things, you'll live the best life you can. And if you have a problem that is bothering you, then that's where the right specialist can help you come up with a plan and help you through this journey on how to overcome that.
That's fantastic. Thank you so much, Dr. Schuler, for sitting down with us today. We'd like to encourage you to take a look at the resources available at spinehealth.org, and thank you for tuning in today.